Is it necessary to strengthen your shoulder or upper back muscle before going for an arthroscopy of the shoulder surgery? It is not a prerequisite to strengthen your shoulder or back muscles before arthroscopic surgery. Of course, it helps in rehabilitation and one should strengthen the shoulder muscle before surgery. But if there is a rotator cuff tear or band-cut tear, then it has to be dealt immediately and one should not wait for exercises to strengthen muscle before surgery. So exercises does help, but it is not mandatory to go for strengthening exercises before the surgery. Is it normal to have frozen shoulder after arthroscopic surgery? No. If the arthroscopic surgery is performed in a proper way, then usually it doesn't lead to frozen shoulder. The patient get full range of motion. Now there are different arthroscopic surgery for different problem in the shoulder joint. For instability like band-cut repair, usually the patient doesn't have any stiffness in the shoulder joint after arthroscopy. After rotator cuff repair, sometimes the patient do get some stiffness, but that is usually recoverable and that usually managed with physiotherapy and exercises. So it is wrong to say that all patients become frozen shoulder after shoulder arthroscopy. In fact, in most of the cases, because the surgery is minimally invasive, there is very less pain, and so the recovery is very faster and the functional results are very good. Very few patients get stiff shoulder after shoulder arthroscopic surgery. Is there any restriction in motion after arthroscopic surgery for shoulder? Are there any other complications? Well, if it all depends on which procedure is being performed. Like if you have performed a rotator cuff repair, then in that case you have to wait for some time till the tendon heals to the bone. So in that case you have to restrict movement for 6 to 8 weeks time, after which you start exercises to gain full movement. Similarly, for band-cut repair also you have to restrict the movement for 3 to 4 weeks, but the patient is allowed to do his normal activities like eating or using mobile or writing, but vigorous activity or heavy activities are only restricted. Can I have both knees replaced in the same time? Yes, if the patient is active, is relatively active, the patient is fit, then in that case one can undergo both knee replacement together. But if the patient is physiologically not so active, patient is having any comorbidities like diabetes or any cardiac problem, then it is always advisable then that you undergo this procedure one by one.